Clients and guests, welcome to another episode of Jason Cerro Talks. Today, you will be listening to Scott Simone, a psychologist at a high school and adjunct professor of psychology at a local college in Rhode Island, who has 2 decades plus experience working with adolescents, teens, and adults. Scott and I have provided coordinated care together for several years, and I have found him to be a tireless worker and a true professional who knows how to balance humor and a no-nonsense type approach with the students. He is also the most dependable colleague I have had the privilege to work alongside. He provides tremendous support and care to his students while being straightforward and honest. In today's video, he will be talking about the role of a school psychologist and his views on mental health in the schools. I hope you enjoy our interview, and please subscribe if you haven't already. Like the video, and don't forget to put the notification bell on so you know exactly when my next video comes out. Without further ado, Scott Simone. Scott, can you explain why schools have a school psychologist?
Sure, Jason. School psychologists have had a variety of different roles over the period of time that I've been practicing in the field. At the start of my career, about 24 or so years ago, the role of the school psychologist was very diagnostic. A lot of evaluations, a lot of assisting families and students to clarify educational disabilities, to develop individual education plans, to work on a variety of different behavior plans and so on. And then over the course of the 20 some odd years that I've been a psychologist, the role has really changed quite a bit to more of a direct intervention role. Sometimes a crisis intervention role.
Yeah, so the crisis intervention part, typically what does that look like from kind of like A to Z?
Well, crisis intervention can take a lot of different forms in the school, and there is a pretty wide variety of helping professionals that might be involved in something like that. So for example, in the high school that I'm currently working in, we have student assistance counselors, 2 social workers, a school psychologist, 4 school counselors, and sometimes there are other support personnel, restorative coaches, deans, and so on.
Yeah.
So depending on how a situation like that develops, there may be a number of different people involved. Typically, once it gets to the mental health professionals, we are trying to assess whether or not the level of risk warrants a referral to something outside of the school system itself. So we may be advising parents and contacting parents. We may be accessing the school nurse. We might be making referrals to outside counselors, or in more intense situations, we may be doing something like a referral to the emergency room for an emergency evaluation from mental health professionals that are based in the community or some other agency like Gateway or Lifespan.
Okay. And so professionally for you, what took you down the path of being a psychologist? You've been a psychologist for 24 years. Why did you go down that path?
Yeah, I ask myself that question a lot sometimes. I have a family of educators, a mother and her brother who were both school principals, and so I have a lot of educators in our constellation of friends of the family. And one of my closest older buddies and family friends was a school psychologist who was kind of a mentor to me. And would tell me interesting stories about, not only the fun that he would have at his job, but also the ways that he would help students and advise families. And initially, when I went to school, I wasn't pursuing psychology. And over the course of the first year and a half or so that I was in college, I became more and more interested in psychology as a major and transitioned over. And ultimately, that wound up in that, back in that same domain of school psychology.
And so your bachelor's degree, was it in psychology?
Yes. My bachelor's degree was in psychology, and I attended the University of Rhode Island, and then subsequently I went to Rhode Island College for a master's in counseling and educational psychology, and then a certificate of advanced graduate study, or a CAGS, in school psychology.
Oh wow, okay. You mentioned before that there's a lot of support staff in the school. What's the distinction, or what's a couple of distinctions between you and other support staff?
Yeah, that's an interesting question, and I think it's a real challenge for families sometimes when they're trying to navigate the system, and even sometimes for administrators. The fairest thing to say would be that a lot of the people in the roles that we talked about, school counselors, social workers, psychologists, student assistance counselors, that our capabilities have a significant amount of overlap. So in many cases, it comes down to, particularly in a contrast between the social worker and the psychologist, who are much more similar in our designated roles. It comes down more to the proportion of time that we dedicate to certain things. I would say, and again, all school departments utilize their mental health personnel differently, and all teams function a little differently. So I would just talk about my experiences on behalf of my team. But certainly, psychologists still have a larger diagnostic role, evaluating students, assisting with the development of IEPs, assisting with the identification of educational disabilities, and also interpreting the clinical reports and recommendations and needs of students and how those would be adapted to the school system when an outside provider is contacting us. Social workers certainly capable of doing a lot of the same things. They may very well also have a role in the evaluation process, conducting social histories, being part of the evaluation team. In addition to that, though, I think it would be fair to say that more of their time is involved in direct service with students, where we would both do individual and group counseling. The social workers would be doing a little bit less of the diagnostic piece and a little bit more of that direct service. Where their role would maybe differ from ours a little bit more too would be the degree to which they do family outreach, coordination of care in the community, and so on.
You mentioned diagnostic tools. What's one or two typical diagnostic tools that you would utilize?
Yeah, it's difficult to isolate a couple. Probably one of the most common types of evaluations that we engage in with students would be to investigate the existence of a learning disability. So cognitive evaluation would involve something like a Wechsler intelligence scale for children. Right now we're using the 5th edition of that, and it would generate a cognitive profile. IQ scores, kind of the typical terminology would be, for parents talking about the developmental level of kids and the cognitive level of kids. We might do a variety of different rating scales with parents and teachers to determine how students are functioning in a variety of different ways in the classroom. That might be a behavioral analysis. It might be to get a better handle on the level of anxiety or depressive symptoms that a student's exhibiting in school. It really can go, it's tough to summarize because it can go in a lot of different directions, but we have an enormous battery of diagnostic instruments available to us.
In terms of when you meet kids for the first time, how do you introduce yourself? How do they get to know who you are and what purpose you serve?
Yeah, one of the things I think about all the time is before I'm meeting students, what is my role in the school and how do I create visibility? I was always concerned about the perspective that school psychologists are an invisible, unknown person that kind of swoops in and takes kids off to do evaluations and then swoops back out again. So I make a really concerted effort to be visible around the school. I eat lunch in the lunch room. I sit with kids in the cafeteria. Generally very familiar to most of our general ed students, not just the kids that I work with. And so that is a head start for a student who needs to meet me because they're having some type of a difficulty and require support. I'd rather be a familiar face even if they don't really know me personally or what I do. Once I meet students, I'm very straightforward with them, very upfront. I explain to them the role of the school psychologist, what some of the capabilities might be that could improve their day. And certainly just maintain a level of honesty and straightforwardness with them. High school kids in particular don't respond very well to sugarcoating and those. They have pretty good detectors for those kinds of things. So just being real honest and real straight with them, usually they're much easier to work with. So
was there a time in your career when you didn't have a direct approach like you do now, where you maybe had a different approach and you found that this isn't really working for high school kids, and kind of shaped how you interact with them today?
Yeah, I don't know if I would say that there was a time when I didn't have a direct approach. I think that I've developed a gradual comfort with just interacting with students the way I would interact with almost anybody. I use a lot of humor with kids, and I try to interact with them in a manner that does not feel awkward and official. And, people come and they see the school psychologist plaque on the wall and they think, I'm here to be evaluated by somebody, and nobody likes to feel like they're being analyzed every moment. So we just talk with kids. We don't use fancy terms. We don't sugarcoat things. We're very honest with students. I like to highlight the purpose of our visits and also what the consequences are of good decisions, bad decisions, different outcomes. And I'm working with students now at a developmental level as teenagers that understand that. They really take to that pretty quickly.
So I had the privilege of seeing how your day, operates, and you and I visited a few times. We've had lunch together, and this one particular day, we were trying to have. This was supposed to be your time off, and it was like 15, 20 minutes, and we're trying to eat lunch, and you literally had a half dozen interactions within a 10 to 15 minute time period. Is that typically what happens? You have support staff that you have to communicate with, you have the phone ringing, you have students coming in, you have to go track a student down. The list goes on, and I was shocked at how much multitasking you have to do.
Yeah, it's fair to say if you want a job where you're always where the action is, school psychology is not a bad choice. It's part of what makes the day fulfilling, but it's also something that you really need to be mindful of, because there are times when you can do that. You can multitask at the same time and manage a few different things. You can push papers while you're talking to someone on the phone. You can respond to an adult in your doorway while you're listening to someone on the phone. But you need to know when to draw the line with that, and that line comes with working with students. So again, undivided attention with a student that's sitting down talking with you, whether it's the first time you've spoken to them or whether you've talked to them for an extended period of time. The natural tendency to be able to listen to them and still look at a computer screen, or be able to listen to them and still pick up a phone real quickly and say, I'll call you back, communicates the wrong message to kids. Like, you really need to put a stop to all that. Close the door, not answer the phone, focus on kids. Or be honest when you can't. There are times when students come down and they need to access me right then, or from their perspective, they need to access me right then. And I have to be honest with kids and say, I can't give you my undivided attention right now. Let's schedule a time to meet next period, or a half hour from now, or right after this concludes, so that they do feel like when you are listening and supporting them that you're doing that 100%. But back to your point, it is an action-packed multitasking day. A lot of different needs around the building, and people do rely, fortunately, on us to do a lot of different types of supportive roles.
I definitely learned while watching you interact with everybody an appreciation, because in therapy, we get no distractions. It is undivided attention, no phone is ringing, no one's knocking on my door. I get 45 minutes to an hour to sit there and just try to assess. So I admire even more how you were able to really not just put out fires, but you really tended to those kids, and you really did give the appropriate attention that they required at that time. So I think it's important that as a coordinated care model that we understand people's roles a little bit and get to experience them, because it gives us better, just a better overall sense of what is going on with that teenager. So I wanted to ask you too about, the rapport and the trust building, and what are some things that you've learned over the years that gains a teen's trust?
The number one thing, actually, I would say there's probably two things that I keep at the forefront of my mind when I'm working with a difficult student in particular, or if I'm meeting someone for the first time. But often the challenge is that I'm meeting a student for the first time who's also a very challenging student and might be in really difficult circumstances. And aside from humor, which is my number one tool almost all the time, is I would say respect and honesty with all kids. And there are quite a few times when I try my absolute best to extend respect to students even when they're not in the process of earning it. They can be in some pretty difficult circumstances, making threats or exhibiting behaviors that are really challenging. And also, as I said, being very truthful and very honest with kids. And sometimes it's never more important than when they're in their worst moments, because it may be that the best thing I can do at that time is use my energy to either be humorous or calm and bring them down a notch, but also to highlight very honestly what the consequences of a good and bad decision in that moment would be, and not necessarily try to force their decision either way, but just highlight for them that they're the ones, no one can control them. They're in the process of making their own decisions, and we're kind of rooting for them to make a good one. Absolutely. But they're on their own. They have to do that on their own.
Oftentimes, you're not the first point of contact for that child or teen. And it might be the parent, it might be a teacher, it might be the school resource officer. I mean, there's a lot of points of initial contact. What do you see as maybe either pitfalls or even positives of that chain where it eventually gets to you?
Yeah. I have a lot of trust in my colleagues because they know their own students very well. So a lot of times if they are referring a student to me, they can provide me with information that really gives me a head start with a kid. For the most part, people that have tried kind of up that progression of helping personnel have tried to get that student into a good place. If they're not able to do that, it may continue to escalate, or it might arrive at my door in a difficult situation. The only time I would say it poses more of a challenge, if there have been numerous people interacting with a kid that's in some type of a distressful situation, is if it's a situation ultimately that calls for an emergency mental health evaluation. Because a lot of people who are not really trained to ask those types of questions have already requested that kids run through that story numerous times. So by the time I start any type of a formal risk assessment with a student, the process can be tainted somewhat by the fact that I'm hearing it now for the fourth or fifth time, or they're starting to suspect why we're asking those questions, or they're modifying the story because they've created more problems for themselves as they've told it to people who are disciplinarians or people that are not looking at it from the same lens that I do. So generally speaking, I would say that the people who are involved in cases before I am are very knowledgeable and trustworthy professionals. But we are actively training particularly personnel in the school, that as soon as you hear something that causes concern or see something or read something, stop immediately and route that student directly to mainly the social worker or the psychologist for a follow-up assessment.
So the other support staff have limited experience in that area, especially with mental health issues, and we want them to stop and then pass it along to someone who is certified or licensed or who is in that mental health support role.
Right. So, we have in both written protocol and in practice within the school department, and I'm sure this holds true for all school departments in some form or another, but there are some people who are certified or licensed to handle those things quite specifically, and other people who are capable of protecting students and making good decisions and routing them to us. But they are not designated as people who would conduct a risk assessment, who would make a significant determination about a student's mental health, about suicidal ideation, for example, or something like that. Typically, the school social worker and the school psychologist are the only two people that would be making a referral for an emergency assessment from the school. Certainly the nurse, or someone else might be making a referral for outside resources as well on a more medical basis. But when it comes to emergency mental health services, that typically would come just from the social worker or the psychologist. We have a highly certified and extremely supportive student assistance counselor in our building as well, who has functioned in that role from time to time. But typically it would be one of those two people.
You mentioned suicide, and even speaking as a therapist, there's a lot of suicidal ideation that some people have a very difficult time talking about. And I recently saw that the CDC reported that from 1999 to 2018, there was a 35% increase in suicide. What factors do you consider to contribute, especially in today's climate, to maybe the rise of suicide?
Well, if I could answer that in one brief summarized response and manage to get it down on paper, I'd be really wealthy. Because I don't know that anybody could really capture all those factors in correct proportions. It's such a variable for each individual person. I do see an enormous shift in parenting style, and I see a general culture shift in probably the country, not just the local community, but in the way need is interpreted, in the way children exhibit or don't exhibit resilience or coping skills. Anxiety and depression have always been, two of the most common conditions and factors that impact teens. That's always been the case. But as you said, the escalation in anxiety in particular has been alarming, and it's been across all communities. So I think that we really need to take a look at how how the entire social climate, not just within the school department, but just within the communities in general, has started to change and evolve.
You know, I was really struck by, you know, I've had clients go to a next level of care, even a hospital setting, where it's supposed to be a safe place. And I've had clients tell me that they're kind of being, you know, told to not talk about suicidal ideation because it may trigger other patients. And while that's understandable, I do think it also contributes to teens, especially shutting down if they're told, you know, especially after revealing such a vulnerable thing. Hey, let's kind of keep that down. So I do think there can definitely be more talk around this area to make it so that people really understand where teens are coming from, especially when they talk about suicide. If I'm a parent, so I'm going to talk from a parent perspective. And, you know, let's say I notice that my child or teen is having a very difficult time. Maybe they're anxious, maybe they're even having a panic attack, or they're really down. And I know they're going to school the next day. I want them to keep it moving and keep going about their day, but I'm a little concerned, and I want to at least let people at the school know. What advice do you have for parents in terms of how they should really communicate to the school about their child situation?
Yeah, you know, one of the most important assets we could possibly have is parent input, particularly in live time. You know, when and sometimes you have to build up trust with parents as well to get that. But I have parents of students who I've worked with for a while who will contact me at, you know, 6:45 in the morning before kids even arrive at school and say, hey, you know, it's been a rough morning. Heads up, you might need to check in. This is going on, or you know, this situation has happened again. And that's enormously helpful because it allows us to be preventative. And I think one of the things that's a big challenge and a frustration for all mental health or all support staff in general in schools is that we are, as you know, you described that scenario of what it was like to be in my office for an hour.
Yeah.
And when you're functioning in that mode, you're 100% preventative. I'm sorry, 100% reactive. And I would prefer to put a lot more time and energy into preventative work. So a parent phone call or information that might give us a tip on a student who's got some unusual needs that day allows us to be a little bit more proactive and preventative, and it saves ultimately a lot of time with the student in a difficult state.
So if a parent is considering looking at their child and they might be anxious or having a panic attack, or they can tell that they're really down or consumed by something, you know, and they want to just let somebody know at the school, you know, should it be an email? Should it be a phone call? Does it matter? It could be anything.
Okay, yeah, that's you know, parents tend to contact the person that they're most familiar with or trust the most, and that's fine, because when you have a knowledgeable staff of people that know not only what their roles are, but what the capabilities of other people's roles are, they're very good about passing along that information, you know, to the people that need it. I would encourage parents in something like a high school model where there are those multiple tiers of support, that if they don't have a teacher that they can contact directly, to call a student's guidance counselor or a school counselor. In more, let's say, more intense situations where they're really concerned about immediate mental health risks, then certainly most school departments or buildings will have a directory where they can contact a school psychologist or a social worker immediately. And any of those types of support personnel will, you know, certainly seek out the student and provide immediate assistance. I have had, just since the start of the school year in the last couple of months, I've probably had 5 parent contacts already. You know, we're in October?
Wow.
You know, early October.
Yeah.
Parents that have called in and given me a pretty detailed description of how their children have functioned over the summer and what their current concerns are. And I'm meeting kids that, you know, are certainly are not on the special needs radar, or have even been identified in the school as having social emotional needs. And we're developing pretty elaborate plans for not only supporting them in school, but what to keep an eye on and how to be helpful at home. Sometimes coordinating services with outside providers. So we're in communication with parents about referrals to behavioral health agencies, to local practitioners, you know, local social workers in the community, or advising them on different ways that they can react to emergency levels of mental health distress at home, accessing the ER, contacting the the police or rescue.
Let's talk a little bit about confidentiality. So oftentimes children, teens don't quite understand exactly what rights they have and what can be kept in confidence and what cannot be kept in confidence. And so in a school setting, is it any different than the typical confidentiality, or is it just like anything else?
I think it's a challenge. I think explaining to, well, again, in reference to high school age kids and the cognitive level that they typically are functioning at, they're pretty mature kids. Explaining to them what confidentiality is and what the boundaries are, they typically have a pretty good handle on that, and that's something that we do right away when we do introductions and we first start talking about our role with students. There are times, though, when they struggle to understand the circumstances under which confidentiality cannot be maintained. And of course, we have students that come to us with pretty serious issues that the reporting of those issues could potentially carry pretty significant consequences and outcomes for them. So it is a concern sometimes when they talk about safety or in the heat of their discussion about their own frustration and anxiety are repeatedly making threats, and we get into a situation where we have a duty to warn other people. Or that, again, we have to communicate, because they are minors, that we have to communicate these concerns to parents, and we have to, we're obligated to send them for emergency assessments when we feel that they're an imminent risk to themselves or somebody else. So, it is a challenge to maintain that level of understanding. Sometimes those things happen really in the spur of the moment, and those moments are often when teens are not thinking as rationally as they normally would be. So they can be pretty combative or disagreeable about those kinds of things, but I find that once they've gone through the process of whatever the the cycle of helping intervention is, when they return to the school and we re-engage them, they're usually pretty grateful that someone was trustworthy enough and helpful and caring enough that they would intervene, whether they agreed with it at the time or not, on their own behalf. So.
Scott, let's say that a parent calls you and is really concerned and maybe even calls you multiple times a day about their child or teen, and they want to know very specific information. How do you typically handle that?
Information about the discussions that I've had with a student, you mean?
Correct.
Okay. Well, at that point, we're really switching roles to alleviate some of the fear or anxiety and apprehension that a parent has about their own child. It's important to respect the boundaries of confidentiality for kids. Yeah. And I think that you can explain to parents why that's important, and also attempt to give them some reassurance that the process that the student is engaged in is genuine, and that they are putting in a good effort to achieve some self-improvements. But generally, you have to be honest with parents that you have an ethical responsibility to not only the process and your professional guidelines as a psychologist, but also to respect the privacy of the child. If you are putting yourself in a position of picking and choosing when to disclose information from a child to their parent, then you are heavily compromising your relationship with the student, and not to mention violating the ethical guidelines of your practice. So
sure.
Parents need to respect that as well, and sometimes they just need a little bit more information to understand that.
And I find that most parents do respect that when there's essentially an assertive boundary put up where, listen, I care, I understand that you care very deeply about your child or teen and you want the best, and we're working together here, but there are certain things that we have to do to get them the best help that they need.
Yeah, and I think an important step in that is how you become engaged in the process in the first place. When students are referred to me very early on, if it's not by a parent, I usually have an opportunity to interact with a parent. And so setting that guideline right in the beginning of what our goals are together, what each of our roles are, what type of information we will share, what types of information we don't share. If everyone has a good solid understanding of that at the beginning of the process, then you really can prevent a lot of the tension or concern that parents have about whether or not they have access to information. They are still the legal guardians of minor children, so it's very natural, I think, for them to want to manage and be cautious for their own child's sake. But we still have ethical responsibilities, and we have to balance that.
Yeah, I know in my private practice, you have to be careful of you can't obviously change or predict how a child is going to perceive your interaction with their parent, but there can be an aligning of the parent in the teen's eyes that would make them not trust the therapist or the school psychologist, or if they feel like as professionals we're joining with the parent. So it is a fine line that we have to also have good communication with the parents, but also respect the confidentiality of our students and clients.
Yeah, and I think where you can really provide some clarity to the student about that, and maybe dispel the sense that adults are aligning and or ganging up on them, as they would probably say,
Right.
is that I try to keep everything within the language of their decisions, and the highlighting consequences of good and bad decisions, highlighting good and bad consequences of the choices that students are making.
Yes.
Because ultimately, whether they're minors or not, whether there are 7 adults involved, 5 adults involved, they are not being controlled by anybody. They're gonna do and say and decide what they're gonna do, and all you can do is provide them with the best guidance and information possible, and at times highlight for them what some of those outcomes that they might not be thinking of are. And then ultimately, they're still going to be the people that they are, and we'll be there to support them.
Let's talk a little bit about meetings and communication with other support staff about a particular student that you're working with. Obviously, maintaining certain confidentiality, yet you have to communicate certain things so that there's an awareness level without violating, obviously, the things that they just don't need to know.
Yeah.
How do you balance that?
Well, it might be a different conversation from one teacher to another. I think that generally speaking, teachers are very understanding about the privacy of students and very accepting of the information that they need to be more effective educators with kids, and also respectful of the information that they don't need that's private. But there certainly are times when teachers feel that they need a little bit more information to be effective interpersonally with that student than they might be getting. So for example, if you were a student in a classroom with a teacher who was very encouraging and very used a lot of positive feedback, used a lot of proximity strategies, I might, but you have a trauma history related to some type of physical abuse.
Yeah.
It might be very important for me to communicate to that teacher that in their efforts to support Jason in the classroom, that proximity strategies are not as effective, that Jason is a student that needs a little bit more personal space than what you might give a typical student, that putting an encouraging hand on his shoulder while he's sitting in his seat and you're looking over his work might be a very alarming trigger for somebody. And I think teachers find that helpful. Control your tone of voice when you're talking to a particular student, because that's a difficult thing for them to cope with. What they don't need to know is why. Or what the basis in trauma is for why proximity or physical touch or an escalated voice, why it is a very negative or an averse stimuli to that particular student. That's just private information, and how you deal with a kid and the ways you deal with them are important to know. The reason behind it is not always important for teachers to know. So I can understand their frustration with that sometimes, but it gets back to confidentiality and student respect and privacy. So,
you are a very big proponent of mental health services outside of the school. You refer to outside organizations, private practitioners. Generally, what factors come into play when you assess for, okay, is this something that's pretty acute and needs some attention, but I don't think it needs some long-term attention? What factors into referring outside?
Well, certainly the nature of the concern of the topic is going to be one of the factors. Ultimately, what we are tasked with doing in school, in a nutshell, is to make sure that kids are not discriminated against, make sure that kids have access to their educations, whether that is, removing emotional obstacles or otherwise. We are not, by design, psychotherapists who are in schools doing, extensive types of interventions of that nature for mental health conditions. However, the challenge about being a mental health provider in a school particularly in an area like South County where we do lack a lot of the mental health services that other communities have, is we sometimes become the only show in town. And it's not an advantage for the student or the family if we take on more than we're designated to do sometimes, even though in the interest of helping a child, most people will do that. Because it's very difficult to wade into really intensive mental health issues during a school day and then have to put, a cap on that time and send kids back off into an academic community where you might have just had a conversation with them about a trauma-related event that's not going to go away when the bell rings, So kids that have to talk about really intense experiences, kids that have to deal with severe mental health issues that require long-term ongoing therapy, sometimes even a team of people that work together with the family for medication, counseling, and so on. That really needs to be a community-based effort. I wish we had a wider menu of psychiatric services down in South County, a little bit more access to thorough clinical assessment. But some of those things are just not, there's a limit to what the evaluation process and the resources in school can provide. And beyond that, our responsibility is to still make sure that we're guiding families to very high quality resources in the community. So, and I find that when I've done that in the past, the people who are very good collaborators with the school are the clinicians that I tend to refer back to again the next time, because if we're on the same page, if we're setting the same goals, if we're using the same language with students, then it's more effective in and outside of school. If kids are seeing people in the community that are not keeping tabs on what's happening during the school day, that aren't monitoring kids' performance, that aren't asking questions about their mental health within the environment of 900 other students in an academic facility, they're not getting the whole picture. It's really difficult to help. We're doing two different things. We're pulling in different directions sometimes.
What would you say are the top one or two mental health issues going on today in the schools?
Number one is anxiety. We probably have more students who refer themselves for anxiety than any other condition. Depression, symptoms of depression are also probably an easy number two. So as far as clinical, mental health conditions, those two, they have no rival, anxiety and depression. We do also, though, work with a lot of students who have executive difficulties related to diagnoses like ADHD, who may or may not be part of the special education department, or they might be on a 504 accommodation plan. So we will work with them on executive skills for things like planning and organization, initiating tasks, work completion. These are the kids who a lot of times have really good cognitive profiles and some ambition and aptitude for school, and they just can't quite get, there's a breakdown in that mechanism somewhere where work doesn't get turned in and grades aren't what they should be, and the effort that they're putting in is high, and their progress is more in that lukewarm zone. So we work a lot with kids on how to use their resources and how to develop their own metacognition, to use a jargon word. Use their resources, reminders on their phone, how to access teachers. One of the most important things I say to students all the time, whether they're anxious, whether they're ADHD, whatever other thing, any kid that's having an obstacle in a class, is have you accessed your teacher and explained to them what's going on? And a lot of students will say, well, I don't really know what to ask. I don't know what to say. And I said, that's fine. Do what you just said. Go right to your teacher and say, I'm not even sure what to ask. Can you help me prioritize? Can you help me increase my grade? Can you help me prioritize what assignments I need to be focused on next? And sometimes just that little bit of scaffolding, that little bit of external support is enough to get them back on track, because they can perform academically. Once they have a plan, once they're reassured that they have a teacher that understands why they're struggling and that is rooting for them, it helps a lot with anxiety. It helps a lot with planning and organization.
So the taping of this interview is October of 2020, and it's been about a month into the school year, and we're in the middle of a pandemic. And what's it been like in your school as far as kids adjusting to what's the new guidelines? Have you seen any differences in their way of going about their day or mental health?
At this stage, we have about half the student, give or take, half the student population in at any given time, because we still have one day of remote learning. And then we have underclassmen that are here 4 days a week. Seniors will soon be entering 4 days a week, and then we have a kind of a hybrid model for the other students who have been coming 2 days, and then based on the alphabet, the other half coming for 2 days. It's hard to judge what the mental health impact of the pandemic has been because we're seeing such a streamlined version of the normal school population at any given time. It's my belief, and I think it's probably supported by what observations I have been able to make, that the kids respond to whatever the tone of the reassurance from the adults is. You know, and I think for students that hear teachers and principals and parents saying, hey, you know, this is something we're all concerned about, but we have measures in place and everything's going to be okay, and it's going to be a great school year. Those kids function really well. And for kids who are hearing, in some cases rightfully so, you know, parents who are really alarmed and are not very confident that the school is a safe place. Often those are the students who will come in and have a really difficult time functioning within the guidelines of what the, you know, what the Rhode Island Department of Ed or the CDC has recommended. But I don't want to overstate that. I really have not seen many students at all who have expressed really serious concerns. It's kind of business as usual for them. They're happy to be back. They're happy to see their friends. You know, that kind of social stimulus takes over, and you know they do follow the rules. They're doing a fantastic job with spacing and wearing their masks and doing everything that we're asking them to do. I think they've exceeded our expectations with that. So, I'm hoping that as things continue to improve, that there won't be a big wave of concern related to student anxiety. It was probably a bigger issue when they were stuck at home. You know, when the routine was even more unusual because they weren't coming to school, they weren't seeing friends, they weren't going out to do fun things. So this is a little bit of a return to normalcy with an odd format.
Yeah, and teens are pretty impressive. They can be very resilient. They can adapt to change, I think, very well if they're put in a position to succeed. So let me ask you a little bit about, do you think there needs to be any kind of systemic change in the school systems where there could be a better system from A to Z on how we can take teens and children and assess them and then move them along in a more efficient manner?
If we had a better system of public transportation in this town, it would be a lot easier for people to move from home to work. I'd like to see more opportunities for part-time jobs for younger students and younger adults. Public transportation is a big problem though, because some of the areas that have fewer economic advantages are also somewhat isolated from public transportation. So getting to part-time jobs is tough. Getting to good community centers and areas for recreation that are positive and that are well monitored are also tough. And having some type of supervision over those areas to prevent them from being misused by, older kids or other people who aren't really there to do the recreational activities that they're there to do.
Right.
And I think there's been an effort in the community from some of our coalition members and some of our mental health providers to improve certain areas, make sure that sidewalks are clear, make sure that younger kids have access to playgrounds, and make sure that, those common areas are functioning again. But if kids arrive there and there's already trouble, there's already other people there that are doing things that the designated areas aren't meant for, then they don't go. So they don't access them anyway.
Can we talk a little bit about what unites and divides this area, this community? Are there some social issues that you've seen that has either divided people or brought them together in a positive way?
I think Westerly has an inherently strong town spirit. I think it's a very tight-knit community. In some ways, maybe a little too homogenous, but there is a lot of unity. There is a familiarity among people in the town, and that can work for the population, and it can be difficult at times too, because people that are new to the town often don't feel that they fit in as quickly as people who are born and raised in Westerly. It's a pretty tight-knit community.
Scott, what initiatives are you working on, maybe within the school or outside of the school, that would further help people who are dealing with mental health?
One of my colleagues, who's also a very good personal acquaintance of mine, is Dr. Kimpton, John Kimpton. And he and I have, for the last, I don't know if I can put the number of years on it, have consulted about a variety of different improvements, not only in the way we deliver mental health services to students, but in the way we'd like to see either systemically things improve or change, or in services that we could offer. And so, you know, when you have a professional day like you described, where there's not a whole lot of minutes to sit and gather your thoughts, sometimes this stuff falls by the wayside, and we've been talking about it but neglecting it for probably a good year now. But what we really are interested in is developing some type of a curriculum to work with students that have executive difficulties, or adults, college-age adults that work with executive difficulties. It's an area where both Dr. Kimpton and I have had success within our expertise, and we have talked about a variety of different mechanisms for doing that, whether it's online resources that people can access, live consultations, even delivering some types of seminars, and we have actually started to develop a curriculum for that people eventually hopefully will be able to access, whether it's to get some type of improvement and support for, you know, their currently active students or even adults. So I'd like to see us set aside enough time. You know, we really try to chisel it out and grit our teeth, and we've been able to do that in chunks, but we've got a lot more work to do before that's available. But that's what I'm most excited about outside of school.
Well, I think that's going to be great for the community. I think it's going to be, especially from two professionals who I have had the privilege of knowing over the last few years and working with. I'm excited for you, and I'm excited to see what you have to offer the community. Scott, thank you so much for joining me on this. I know some of the things that we talk about privately can be very difficult even for you and I, and spreading a lot of this knowledge to the community I think is going to be tremendously helpful, and I'm hoping that our talks will be continuous and that we'll have new initiatives to discuss and help the community.
Yeah, that would be great, and thank you for having me. And you know, as we get more and more specific about certain things maybe that come up, we can nail things down a little bit better. Try to be as general as I can so that the information applies to other schools or other communities. Every team does it differently. Every team has different specializations and different skills, but I'm really fortunate to work with a good team at the high school, and yeah, I look forward to coming back and talking to you again.
Thank you. Scott, thank you once again for taking some time out with Jason Cerro Talks and sharing your views on mental health in the school setting and the new initiatives that will be taking place. Please post your questions below, and we will have Scott back on to answer your questions. Please subscribe if you haven't already, like the video, and don't forget to put the notification bell on so you know exactly when my next video comes out. As always, be where you are, be resilient.